patients with spina bifida. I would like to congratulate all the presenters and also to thank the organizing committee to invite me to this conference. Spina bifida is a congenital abnormality that arises from incomplete development of the neural tube. It's commonly used as a non-specific term referring to any degree of neural tube closure. It can be further subdivided into spina bifida occulta and spina bifida apart. Spina bifida occulta, or closed spinal dysraphism, is the mildest form of the neural tube defects, which involves a hidden vertebral defect and minimal neural involvement. Spina bifida apart, or open spina bifida, refers to a defect in which neural tissues communicate with the external environment, such as meningocele or meningomyelocele. The mainstay of treatment of this issue is to prevention. And Western medicine is usually advise women to use acid folic to prevent this formation of spina bifida in their babies. But this presentation will be following Hippocrates that said that foolish the doctor who despises the knowledge acquired by the ancients. And for this reason, I will use the reasoning used by traditional Chinese medicine that exists for more than 5,000 years to explain which are these energy alterations in patients with spina bifida. All this reasoning began in 2007 that when I treated one specific patient that I will show you his history to you to understand what I want to say. This is a 70-year-old male patient that was complaining pain in both legs for the last 6 months with no improvement, only using anti-inflammatory medication. And he went to my clinic to search for another type of treatment. And he is diagnosing traditional Chinese medicine was kidney iron deficiency, leading to that pain in the legs. And I treated him, changing his dietary aspect and doing auricular and systemic acupuncture. And after 10 acupuncture sessions, he returned and said that his leg pain improved, but he also improved from another condition that I was not aware, that he was treating for glaucoma for the last 40 years with no improvement of his condition, only using eye drops. And for the first time of his life, his intraocular pressure reduced from 40 to 17 mmHg when I treated his energy alterations. And these energy alterations is what I want to show to you in patients with spina bifida. This is a tree metaphor that I usually use in all my presentations to show you the different viewpoints between Western and traditional Chinese medicine. This tree is divided into this part above the earth and the part under the earth. The part above the earth is what Western medicine is treating nowadays. It's composed by the trunk with several branches, and each branch means one medical specialty, for example, neurology, orthopedic, pneumology, pediatrics, etc. And coming out of each branch, you can see many leaves, and each leaf means one symptom or disease treated by each medical specialty. And for example, spina bifida is treated by a neurosurgeon in leaf level. But what I want to show you is that the traditional Chinese medicine understand that all kinds of treatment in all kinds of the disease, the problem is not on the leaf. The problem is on the root, that are these energy alterations composed by yin and yang and the 5-element theory, that I want to explain to you what is happening in this root that could be leading to this problem in the leaf level. And TCM also considers the influence of the external pathogenic factors, such as the influence of cold, wind, heat, humidity, and dryness, leading to formation of the disease in the leaf level that Western medicine do not consider until today. And the third theory in the root of these trees, the yin and yang theory, is composed by, is symbolized by this symbol. Yang is this white part and yin is this black part. And they are two energies that are opposite, but they are complementary, such as man and woman, day and night, sun and moon, and summer and winter, etc. And these two energy exist in our universe, in all the things. And this is the balance state between this yin and yang energy that we need to achieve in all kinds of treatment to achieve health of the patient. And when the patient has an imbalance between these two energies in the root, when the yin is less than yang or yang is less than yin, there is an alterations in the leaf level that Western medicine is not usually treating, and only treating the symptoms, because the symptoms in the leaf level in TCM is caused by these energy alterations in this root. For example, yin deficiency is very common in women. Any patient with diabetes has this yin deficiency and formation of internal fire that I will explain to you later. And yin deficiency is very common in women in menopause, when there is a hot flashes and irritability and hot sensations, because this yang is very energy that can make the patient feels hotter. And when the patient has yin deficiency, the patient has this sensation of hotter in the body. And not only women in menopause, it is very common in all kinds of age groups. Since babies, children, adolescents, they can have these hot sensations. And the yang deficiency is when the patient can feel colder in the feet and hands, and this situation is very common. And when the patient has yang deficiency, it's very common to see liquid retention. They can have obesity due to this liquid retention, or can have urinary incontinence due to this yang deficiency, or to have uterine or bladder or rectum prolapse due to this yang deficiency. And that's why in TCM, when you treat this condition, rebalancing this energy, leading to this balanced state, you can treat the patient's conditions without even using surgery or any kind of tools using in Western medicine, because regulating all these energies, we can achieve health again. And this is the cornerstone of all traditional Chinese medicine reasoning and treatment. We needed to treat all these four forces in the root to achieve health in any kind of disease, in any kind of specialty, such as emotional or physical symptoms, such as in treatment of anxiety, depression, panic syndrome. All patients with any kind of disease has in common these energy alterations in this root. Yin and yang are two energies that is produced by the kidney, blood is produced by the spleen, chi is produced by the lung and liver. And when there is an imbalance in these organs, there is an imbalance in production of these energies, leading to a deficiency or yin or yang or chi or blood, or a combination of these four energy deficiencies, leading to diverse clinical manifestations in the leaf level. And yin deficiency is characterized by hot flashes, and yang deficiency when the patient feels colder. Blood deficiency is when the patient do not have daily bowel movement, and chi deficiency is when the patient has abdominal sweating during the day. I am showing all these alterations to show you the problems in the spina bifida later. And when the patient is having these energy deficiencies in the root, there is a formation of internal fire in the root, leading to some clinical manifestation in the leaf level, and all kinds of such emotional symptoms such as anxiety and panic syndrome is characterized by these energy alterations, energy deficiencies in the root, and formation of internal fire. And all kinds of infectious disease, for example, has community and hospital infection, they have in common these energy alterations in this root and formation of this fire. And I have some publications showing that I can treat hospital or community infections, only rebalancing this energy in the root without using any kind of antibiotics, because the cause of the infection is not the infection itself, but is the energy alterations in this root and formation of this internal fire. And when we take out this fire, the bacteria will not have condition to survive, and the infection will resolve. And the second theory in the root is the 5-element theory, is composed by wood, fire, earth, metal, and water. And these 5 elements corresponds to 5 internal massive organs in our bodies, such as wood corresponds to liver, fire to heart, earth to spleen, metal to lung, water to kidney. And these organs they are responsible for the functioning of one external sensorial organ. For example, liver is responsible for eye, and heart is responsible for tongue and communication. Spleen is responsible for mouth and sense of taste. Lung is responsible for nose and sense of smell. Kidney is responsible for ear and hearing process. And that is why in TCM, when the patient is having eye problem, for example, glaucoma, they do not treat the eye itself, only giving eye drops, but they treat the liver. But in traditional Chinese medicine, you can see that all organs are interconnected by the energy flow. They do not work independent or separately like Western medicine reasoning. And liver is receiving energy from kidney, kidney is receiving energy from lung, lung is receiving energy from spleen, and spleen is receiving energy from the earth, and all elements, they are interconnected, and one organ is working together with the other organ. And that is why in TCM, if one organ is ill, for example, the kidney is insufficient, the problem could be not in the kidney in TCM, but the problem could be in the lung or liver or spleen, because all of them are exerting influence in the other organ. And in this case, in this study, I will show you one patient that had the spina bifida that she is my patient. She went to my clinic this year. She is a 30-year-old female patient. And she was having low back pain because of spina bifida that was diagnosed since the diagnosis when she was a baby. And at that time, the neurosurgeon recommended to vest a vest to firm the spine to treat the back pain. And she went to my clinic to try to reduce this local pain. And I measured the energy of these 5 internal massive organs of the liver, heart, spleen, lung, and kidney using a radiesthesia procedure to see how was the energy of all these organs, to show to you which are these energy alterations that was leading to the symptoms of spina bifida. And all her 5 internal massive organs were in the lowest level of energy. And how I measure this energy. I measure the energy of the 5 internal massive organs, measuring the energy of the chakras energy centers. The chakras energy centers are energy concentrations that we cannot see by the naked eye, but they exist, and they are very important to send energy to all organs, glands, and systems to their proper working. And there are some studies correlating the chakras with the 5 internal massive organs. And when I measure the energy of the chakra, I'm measuring the energy of these 5 internal massive organs. This is the first chakra, this is the second. The first corresponds to liver, the second corresponds to kidney, the third corresponds to heart, the fourth corresponds to lung, and the fifth corresponds to spleen. The sixth is the kidney, is the memory and concentration, and the seventh it was a spiritual chakra. And as you can see, I measure this energy using a crystal pendulum, putting in front of each chakra and to see the movement of this pendulum. And when the pendulum do not move, this means that the chakra or organ do not have energy. In her situation, all organs were in the lowest level of energy, and the energy that was leading to back pain is the kidney that was in the lowest level of energy. But as I show you, the kidney depends on the kidney is the water element, depends on the energy of the lung. The lung depends on the energy of the spleen, that depends on the heart and depends on the liver. And all the 5 elements were in the lowest level of energy. And according to traditional Chinese medicine, low back pain caused by the spina bifida in this situation was caused by the kidney energy deficiency. But to treat the kidney, I need to treat the whole system, because the whole system were in the lowest level of energy. And that is why the first step in her treatment, I changed all her dietary aspect. First, in this slide, to do not imbalance even more the spleen and pancreas energy, to increase the absorption of nutrients, avoiding the ingestion of dairy products, cold water, raw food, and sweets, because all this food can reduce even more the energy of the spleen and pancreas and lead to worsening of the absorption of nutrients, that is the function of the spleen. And the second group of foods was to avoid the ingestion of fried food, egg, honey, coconut, alcoholic beverages, and melted cheese, because all these food can induce the liver energy disharmony and leading to alterations in the kidney also. And the third group is to avoid the ingestion of coffee, soda, mate tea, because all these drinks can reduce even more the kidney energy that's already very low. And that is the cause of the alterations in the leading to low back pain. But in this patient, she had 30 years old. I do not know when she was born 30 years ago, if she had these energy alterations. I know that all patients nowadays, not only patients with spina bifida, had these energy alterations, but the majority of patients with any kind of diagnosis have these energy alterations in these 5 internal massive organs. This was research that I did in my clinic, studying 1,000 patients from 2015 to 2020, showing that the majority of the patients, independent on the age group, independent on the type of diagnosis, could be only have anxiety, depression, panic syndrome, insomnia, low back pain, or knee pain, or headache, or diabetes, myocardial infarction, hypertension, or any kind of cancer. They have the same energy alterations. And the second step in the treatment was to rebalance this energy in the 5 elements using the auricular acupuncture. Is a tool in traditional Chinese medicine, very important nowadays, to regulate the internal energy using a mustard seeds applied using a small adhesive tapes. And this is an apex blood dilating to take out the heat. And this is a procedure that they usually use in all kinds of pains. In this case, she was having low back pain, the spina bifida location. But in Western medicine, they were thinking that the pain was caused by the spina bifida, but the pain was caused by these energy deficiencies in the 5 internal massive organs, mainly in the kidney. And this 7 is the kidney point. This is the liver, this is the spleen, this is the heart and lung point to treat these 5 elements. And I do not show the treatment in the low back, is in this region. We put the auricular points in this region. That is all column. And this is a research that I did in my clinic, analyzing 1,000 patients. You can see that independent on the age group, this 1 is the liver, 2nd is the kidney, 3rd is the heart, 4 is the lung, 50 is the spleen, 60 is the memory and concentration. All of them were in the lowest level of energy, and this alteration is caused by the chronic exposition of the electromagnetic radiation that we are all exposed nowadays due to the modernization of telecommunication, leading to a state of immune deficiency of our body, independent on the type of diagnosis. And this is leading to, because our energy is our immune system. And when our energy is very low, our immune system is very compromised and leading to propensity to have infectious and infectious disease, such as in this article that I published this research. I am showing the propensity to have COVID-19 because the population is very immune compromised and not immune competent. And the increasing chance of having any kind of non-infectious disease, such as diabetes, myocardial infarction, or even any kind of cancer is caused by these energy alterations in these organs nowadays. And that's why we need to treat this condition, replenishing these organs' energy, including us nowadays are in this situation, and we need to treat this condition using high diluted medication. Why high diluted medication? Because there is an Einschutz law that was created in 1888 by 2 German researchers, and they were saying that the use of any kind of high concentrate medication will reduce even more our vital energy, and that is why the medication of choice in this new type of population that we are having nowadays are the use of more high diluted medication to increase this vital energy. And when we use any kind of high concentrate medication, we will reduce this vital energy, and that's why the patient could have more propensity to have any kind of infectious or non-infectious disease, or have blood to circulate inside the blood vessels. There is the necessity of have energy, and when we reduce this energy using high concentrate medication, such as anti-inflammatory, antibiotics, anxiolytic, antidepressant, any kind of medication will reduce and can lead to death of this patient. And that is why I wrote another article saying the medication of choice in this new type of population nowadays is homeopathy due to these energy alterations in our populations. And to treat the liver, I use phosphorus. To treat kidney, I use natrium muriaticum. To treat heart, I use sulfur. To treat lung, I use silicium. To treat spleen, I use calcarea carbonica. And this, I use all these 5 medications nowadays in one bottle. And I usually orientate the patient to intake 20 drops of each medication per month. And also to prevent COVID-19, I'm using a high diluted oral vaccines made by SARS-CoV-2 nozzle, and not using these kinds of high concentrate vaccines, because high concentrate vaccines can reduce even more our vital energy and leading to a picture of thrombosis or myocardial infarction that we are seeing nowadays. And these are some articles that I wrote. There are more than 160 articles published to show the different energy alterations in each type of diagnosis in Western medicine. But what I want to say in all kinds of articles is that patients with all kinds of cancer, such as prostate, kidney, or any kind of breast or ovary, they have in common these energy alterations in this root. And what we need to treat is to treat the root and not only the symptoms, because nowadays we are only treating the cancer itself, but we are not treating the cause. The cause is the energy alterations in this root of this tree. And this is the article that I'm showing that the population nowadays are very deficient in energy and having more propensity to have COVID, but not only COVID. And this is to show that the majority of population are immunocompetent and not immunocompromised, immunocompromised and not immunocompetent because of these energy alterations. And in COVID-19, patients with anosmia and loss of taste is caused by this lack of energy in the lung and in the spleen, and not caused by the virus itself, because in COVID-19, the patient is having these alterations before the infection. And this is to show that infertility in patients with oligospermia also have these alterations. And patients, all kinds of disease nowadays have these alterations. Patients with glaucoma, patients with Bell palsy, patients with all kinds of complications of COVID-19 is caused by these energy alterations in this route, but is caused also by the type of medication that we are using to treat this type of patients. Because if we use any kind of high concentrated medication, the vital energy will drop and we'll have any kind of complication, such as skin problems, such as thrombosis and any kind, or even death, is caused by the type of medication that we are using today. And this is the new theory in homeopathy that I showed to you when I am using homeopathy medication to treat these 5 elements. I am using the traditional Chinese medicine reasoning, but using a homeopathy medication to treat this energy deficiency condition. And in this theory is very important to us to know and to learn how to use, because any kind of patient, including baby, student, adolescent, and patient with spina bifida also have these energy alterations condition that we need to replenish these energies organ to treat these alterations in this route. And here is another article that I'm showing the homeopathy is the medication of choice to treating the elderly patients. And this is another article showing that the cause of interstitial cystitis is caused by these energy alterations in the 5 internal massive organs. And only to finalize this presentation is to show that homeopathy and acupuncture are 2 medical specialties very important to be used in all kinds of specialties in any kind of disease, because we need to treat the energy imbalances in the root and replenishing these organs energies using a high diluted medication, or treating the leaf level using homeopathy medication. And they are very important tools to be used in any kind of disease nowadays. And to understand these energy alterations in patients with spina bifida, we need to integrate Western with traditional Chinese medicine. And the conclusion of this study is that patients with spina bifida also have alterations in the 5 internal massive organs that are liver, heart, spleen, lung, and kidney. And the use of tools to replenish and rebalance these new organs is important to treat the root and not just the symptom. According to Hippocrates, we need to use our medicine as your food and our food as your medicine. Thank you for your attention. If you have any questions, I will be very happy to answer you. Thank you.
Thank you, Huang, for your nice presentation. It's actually a new thing, a new dimension. I think need more exploration.